Good evening now. This is just Dr. Bill Wyatt with the American Orthodontic Society, and I want to just talk to you this afternoon about a case that's got a closed bite and then several other problems. Most everybody you get hold of seems to have more than one problem at all, and some of them are psychological, and you need to be able to work with those too, and see if you can solve that for young people. Anyway, we're going to take a look at this case right here, and I'm going to just kind of talk about this young man. Now, he's got a kind of a a straight facial profile over here. Let me get my little pen going here, and he has just a very straight facial profile, and we end up, he was missing some teeth above, and I think we take another molar tooth out up above to work on this. And this is after we finished. You can see the difference in the smile here, and it took a couple more than 1 year just to do this case. Let's go on to look at the models now. And when you look here, you can hardly see these lower teeth. They're down underneath the upper teeth, and the permanent teeth on the bottom come all the way up to the gum line, and these teeth lap over here. Now, in this particular one, only one lateral's lapping, the other one isn't. The cuspids are kind of out to the side. He's eating, coming together pretty good on the sides of the model, and we went through this. I'm just going to show a very few slides on it. We have the 3-to-3 we bonded on the lower anteriors to keep it back down. This tooth here is a little longer than other. It would have been probably better if I had just kind of smoothed this off just a little bit and rounded the corner and got it looking a little more like the tooth over on the other side of the mouth. It probably would have looked better. So let's take another look here at some other pictures. And when you put the two sets together, you can see that the lower jaw is just locked in here. When he closes his mouth, the lower jaw has to come back, so the condyle, if you looked at the fossa and everything back here, the condyle is probably pushed to the distal more than it wants. In this type of case, you can have a TMJ problem with it irritating that retrodiscal tissue, but in many of them you don't. It just has room enough there. But you would take somebody that's having pain with that, and you can put your fingers right up here in front of your ear just a little bit and kind of wiggle your jaw from side to side. And you can feel the top of the condyle, you can feel the sides of it and everything else. And if that person is having a TMJ problem from a soreness or irritation in the retrodiscal tissue, you won't be able to put your finger up there. They don't, that hurts, and they'll cry about it. Now, so we just take somebody like this and try to open their bite. In other words, their jaw is closing down like this, and they can't get their jaw forward like it really wants to be. So you have to pick these teeth up. And as we hook onto the tooth up out here in the front, we're out in front of that tooth, and the root of it goes up here. And as you raise this up, this tooth will move to the front. And as it goes up, it'll bring these other teeth up. And here's what we've got on the case. You look at it, and you see this wire right here. Well, it would go way on up high, maybe higher than that, down the other side. We pull it down and attach it to these teeth. We attach it to the other arch wire. Now here we've got the rectangular wire, so we're finishing this young man out. And this is picking these teeth up. And it pushes down with the molars just as much as it pushes up on the anterior teeth. So we've got two upper molars that are being pushed down, or they kind of tend to want to cock the tooth down like that, like you'd put a prize in that and you're pulling this down. That tooth will move around and the roots will come up, and here, if it comes down, it would do that. But people chew on this, and if they chew hard enough there, this tooth will pretty much stay where it is. But he doesn't chew as hard as I like, so we'll look at it in a minute. Now the lower, we put this to dip in the arch wire, and we brought it down. So we're picking this up, not on the anterior part. So you see these teeth coming up, and they also come out as they go up. And these in the bottom go down, and they will, excuse me, they will come to the buccal too. So when you get the jaw freed up here, you've still got a class 2 malocclusion. So you really want to carry this and get that tooth out here where this cusp is coming right down between that. So this jaw will be out for when you get through treating the guy. Now, this has already happened in here. We pick this up. So you see where this cuspid is coming right down through here, and over here, here the cuspid is, and here's where we want it to be. In other words, we want to bring it out and have a meeting in a class 1 relationship out here. The same thing down here on the bottom. You see the cuspid is back here. That's where it should be. Over here, the cuspid is way up front, and we've got an overjet and overbite or tremendous here. People with these closed bites can't chew like you would if you had your bite open properly. Like you can move your teeth from side to side. You can come out here and bite the lettuce and the sandwich off, and your head of the condyle just moves kind of down the eminence here, and so your back teeth don't touch. If I bring these teeth out to the front here, and this lower teeth comes up there to bite a sandwich off, these teeth should not be touching. So the weight is on the condyle up here. In other words, when you bite with your front teeth and your teeth are working properly, you're going to put pressure on the joints up here, and the muscles are right in front of the joint. And so for you to bite with, say, 10 pounds of force out here in the front, you might have to have 25 or 30 pounds of force back here because you're right close to it. And that puts that weight on the jaw joint. So you have to think about that when you have problems with the disc and they're wearing out. Now these discs that are on top of the condyle, in other words, you got the fossa. Let me just kind of put a white deal up here for a minute, and we got this is the fossa in here, and the condyle would be sitting in something like that, and you've got this double concave disc here. And as you open the bite, move your jaw forward, this condyle moves down on the disc. As it moves down on this, that separates these teeth down here, and it allows you to let your front teeth, that's not a very good drawing, it's kind of a backward drawing down here. In other words, you can touch your front teeth out here together, and these teeth won't be hitting. Now the same thing happens when you move to the side. You should dare to chew on these side teeth, in other words, and the other side would be in contact. Well, if you have a fossa over here, and you got one on this side, and you chew to one side, this one, if I chew over this way, this condyle will come down here, and these teeth won't touch on this side, but you can chew on the other side of your mouth. Now, I know if you've studied dentistry and everything, you know all this, or you should know it, but a lot of people don't, and they don't take into consideration how the jaw works, and that's the way you need to finish the person up so that they can bite with their front teeth and their back teeth don't hit. And I can chew over here, and these teeth over here don't hit. If they do hit, then you have to kind of bite the jaw harder, and you bend, you twist your jaw, or you create problems with it when it occludes wrong. Now, I don't know who had people do it, but there are so many articles written about saying if you have TMJ problem, you don't have anything to do, it doesn't have anything to do with your orthodontics. And that is not correct. That is absolutely wrong. Now, you can have problems with it if you're doing orthodontics, or orthodontics can create it, regular dentistry can create problems with it. Just nothing will create problems if it moved in the wrong direction. So you have to figure out what it is going on there. Now let's get back to our regular case right now. And you see this is a class 2 deal with an overjet of about 1/4 of an inch. And then we're going to raise these up, lower these, and we did it with this. I think I may have had an intruding arch on the bottom, and I don't get a picture of it here. The bottom's level out there now, and then we come down. So let's go now and see if we can look at something else here. Now, in this particular case, the upper were out, and I don't really think that I needed to take out these upper 6-year molars, but I think that's what we did. And I may have made a mistake, but I ended up getting it right where I wanted it to. Now, let's talk about rotating teeth. You see, this tooth needs to be sitting in there about like this, So you got to turn it around that way. So when we've got a arch wire coming along here, you take a little chain. You've got 4 deals on a chain, or you cut your one, and you stick it under here, and you pull that thing, and you'll have that chain hooked onto the wire here. You go under the contact point, wrap it around. Now, if this slides over the tooth, you put a little composite here to keep it from coming over. And now you go around the tooth, and if the bracket is over here, then you pull that with this thread you got tied onto it. We've got a video, the whole thing showing you that. And you pull that so that the end of this little chain is over the bracket, but not over the dental arch that you've got in there, see? It's tied to it here, and that keeps the arch right there. As you pull on this, then this tooth will tend to just turn around. That is the most efficient, best way to rotate any tooth. If you've got very much, if it's just a little bit, you can slide your bracket to the side or put a little wedge or something like that. But you could actually turn that tooth around 365 degrees if you wanted to. you can move them and do all sorts of things. So now look at the shape of this arch right here. See, it's not, the guy is not using his tongue properly in here, and this is kind of going off to the side. This has more room, and this is tighter in here. So we're going to have to line this thing up and shape it much better than it is now. And we took some teeth out, which I don't really think was necessary, but, and there may have been some reason that I did this that I have forgotten. It's several years ago when we did this, but we pulled these teeth together in here. Now the intruding wire that pushed this up kicked these teeth back some. And so we'll have to pull them together, and we'll pull it up to here and close that space. And if we didn't want this to come back at all, you could come into your cortical bone with a little tiny screw, and you can bond that tooth on over here, and you can turn this one around. You'd have to bond it too, and this will stay where it is, and these teeth will come forward. That's something you need to, we've got a video on that too, that'll show you. It's kind of nice to, I mean, this YouTube thing has just been a godsend. Now this was done back when we didn't wear gloves. This was before the gloves were absolutely necessary. So you can see that lady there. Now here is this little tooth. You see it's turning around like that. We hooked over here. This one is rotating in this direction. And so we hooked the here, and we wrapped it around, and we came over here and put it on the bracket. And that tooth will turn all the way around over here, and you pull it a little past it, and then take this off of it. And then, of course, you're going to tie it to the arch wire when it gets around there. And there this tooth is, you see, it's rotated around, and these teeth are brought back up to the front. Let's go on now and see what else we showed. Now, here it's a little further down the line, and we've lined all these teeth up like this. And that was not that way to start with, of course. And here I have the deal fixed out. He had a space over here until we close it on that side. So that kind of balanced the facial structure out there. And we level this bite out here, and these teeth are closing right up with that. And let's see now. Here is the young man after we finished, and he's got a good line, lip line. He doesn't show that, and the teeth are lined up good. And you can just do all sorts of things to people's teeth, and it doesn't matter if that guy's 16 or 18 or 30 or 40 or 50 or 70 or 80. And I think actually you could do it when this person's 90. Now, I'm over 90, but I think my teeth would move. And the bone structure's good on everything, and you could do that. So that's, I think, a wrong thing that people have been taught, that your bone structure gets set when you're 25 or 30. I've had people right back in orthodontists would tell them, well, we can't move it, we can't do anything. Your bone is set, and you can't really do that. This is not correct. I don't know who taught that or who thought it up to start with, but it is not correct. And I know that because I work on people that are 70 and 80 years old. I've never started a 90-year-old from scratch, but you could do that. Now, there are a lot of things in orthodontics where people have been taught that they can't do certain things. Like, say, you can't push the cuspid teeth on the bottom back, they'll always come back. Well, if you just do them this way, they will. But if you move the roots back on those cuspids, and I did a girl like that, 10 years I checked it, and after 20 years I checked it, and the teeth are still there, and I would bet you if when that lady passes from this earth, that those teeth will still be there. So let's see if we've got anything else here to show. I think that's the end of it. And I appreciate you joining our group. And this YouTube deal has made it possible for us to tell people anywhere in the world, and I would like for you to join it. So we have over 5,000 people that subscribe to this. Is about, but I would like to have 10,000, 20,000 or something, where we would know that I've been lecturing on some of this stuff for 40 years, and it's very few people that ever start doing it, so that people could start opening the bite and pulling this jaw forward and putting it out here. Just the jaw in many of these Class 2 Division 2 cases will actually come out there. You just pull on a little bit, you can put it there. So thank you for watching. It's getting pretty late at night, and I'm glad that you tuned in or got on this thing, and we'll try to keep doing this as long as I can. And I hope that we're able to change the way people do some of the orthodontic things that they're doing wrong these days, and can do that. And thank you again for watching, and I'm going to close this out. Thank you now.